My name is Latoya. I'm one of the bilingual speech language pathologists here at St. Anthony Hospital. I tend to care for patients who are inpatients upstairs at our hospital and also outpatients, so across the lifespan pretty much. So when it comes to patients here, typically my day is split between outpatients and inpatients. For the outpatients, we do a lot of pediatric language and or speech. So when I say language, what that really means is how someone is able to express themselves. So we might have someone who comes in and they're not really saying much, or they might be using a lot of gestures, which are helpful, but not as specific as we want them to be. So really my approach, and I'd say a lot of the therapists' approach here, is to go based on what the patient prefers or responds to, considering the different needs patients might have, whether it's sensory based or just preferences and background and cultural differences. So I feel like that's been a really helpful way to go about stimulating more language use and expression of wants, needs, ideas, and then sometimes having parents present, and they can then model what we do and also follow up with this at home and hearing stories about what success there was, like, oh, well, they said this day, and now they're not pointing, they're actually trying to say this word we learned last week in therapy. When it comes to a lot of our patients who need speech needs, it's literally saying sound. So when someone says, oh, you do speech, you help with S's or T's, it's like, yeah, sometimes that's kind of what it is, and it gets really mechanical for some of our patients, especially when they're children and having them attend to doing speech drills. But the approach with that is often play-based, and like I said, regarding preferences. So whether it's going through lyrics to a song or watching a Spider-Man video, we go through different words and sift through them and then try to get targets, as in the speech sounds we want to work on. And that's been helpful for patients to participate and actually enjoy coming back to therapy instead of just saying T 100 times while sitting down. In terms of inpatients, a lot of our patients upstairs have dysphagia. So when I say dysphagia, what that means is just literally disordered swallowing. So kind of like if you're drinking something, you start to cough, it went down the wrong tube. That's what that kind of is comprised of. And our approach with that typically is just seeing what the patient can do and then realizing how safe they are to eat or not to eat and what other alternatives we have to look at. And that's really nice because we have been doing a lot more with our dietitians here as well as our dietary staff to make sure that patients get the specific care that they need, are safe while they do it, and also educating other staff members based on what liquids a patient can have, and how they're going to consume their appropriate diet.